Hi everyone, I'm Dr. Zainab Vora and I'm very happy to have Dr. Sahithi with us, who's cleared her DNB Radiology Theory Exam with an amazing score of 267. So congratulations, Dr. Sahithi. How are you
Thank
feeling?
you.
And one hurdle is done. So I'm
Yes, ma'am.
sure it's a big sigh of relief. How are you?
Yeah, good, ma'am. Actually, in the department right now.
Yeah,
So, yeah, scoring that I also didn't expect, ma'am. But yeah, because we didn't get so much time also to prepare, ma'am.
yeah,
And yeah, with the help of the app and the theory DNP books, that actually gave me a good insight into how I have to go further. Then that's how, like, I started from there, and then slowly approach videos, particularly
yeah, yeah.
approach to all the cystic lung diseases, approach to all the diseases. And luckily, what happened, like, whatever the notes I have made, like, I actually got the notes also to show. This is the notes I made out of the CR.
Amazing.
So many classifications, approach to ILDs and all I have written. And
Yeah,
luckily, we got many questions from the notes that I wrote.
amazing. That's
So
very nice.
I was like,
I'm pretty sure you're gonna get a lot of comments under this video asking for the notes and send these notes.
so
So,
like, no, actually, people don't believe, but I have written MR artifacts in these notes. That
mhm,
was a question.
amazing,
I have
yeah,
written brain tumors classification. That was a question.
yeah.
So it
I think
happened to be
yeah, the theory paper also, I studied them this time also, to see the pattern, and they have a pretty, expected set
uh,
of topics that they keep revolving around. So I think, if you just study the last 3, 4 years topics also, it gives
yes,
you a brief idea as to, what they are going to ask. They
yeah, yeah.
really
But
surprise
that, yes,
good.
ma'am. We had a bouncer of MR elastography. Like
Yeah.
people usually study ultrasound elastography, no, ma'am. But you took a video on MR
Yeah, yeah,
elastography.
yeah, yeah, yeah.
I somehow happened to watch it twice, and then I
Amazing.
exactly
Yeah,
wrote what you
great.
told. So it was like uh, more than
I
half of the credit
yeah.
goes to like CR. So
I'm so happy, that it helps. I just feel, that even if you know some bit of it, you've heard it somewhere, you've reported a case of something, I think becoming and, writing a theory answer on that becomes kind of easy.
yes,
So
yes.
you need to know something about everything. I think that's what is important. So just tell me, about your MBBS and DNB journey also, like which hospital, how is it, how's the residency been like?
Yeah. I did my MBBS from Mamta Medical College, ma'am. It's a private college from
Mhm.
Khammam. It's in Telangana.
Right.
And then I prepared my NEET PG in my internship time, but I scored some 25,000 rank in that, so I couldn't get a free seat. So then
Right.
again, I gave a second attempt. During that second attempt, I was completely into MER. That
Mhm.
Midnight Express
Yeah, yeah.
started with my year. Okay.
Okay.
So from your MER 1, that night, actually, I was not able to read only. Then only you started that thing telling ki all midnight owls can listen to the classes. So that's where my journey with you started, ma'am, MER. And then now to BTR camps and all are happening,
Yes,
but that time
yes, yes.
so,
Yeah.
I like we did some two times.
Hmm.
And yeah, like all the cliche questions and all from BTR only.
Yeah, yeah.
And yeah, so MER concepts were actually very nice from that. So
Great.
from there, the journey started, ma'am. And both of those sessions helped me to score a rank of 1079 in NEET PG.
Very nice.
Hyderabad,
Hmm.
I'm doing Continental Hospitals, ma'am, Hyderabad.
Right.
So yeah,
How
that's
is the residency there?
it's okay, ma'am. It's good only. Like everywhere, there is some pros
The
and cons.
practicals are still left. Let me just remind you.
Yes, yes, ma'am. September 12th, I have.
Yeah.
They're going to release this, I don't know.
No, no, no. We'll release it for sure. But yeah, I don't think that'll affect anything. Yeah.
Yeah, yeah.
Yeah.
So yeah, September 12th. But we didn't expect practical to be so sooner, ma'am.
Yes.
We just have 20 days left.
Hmm. Yeah.
So even now also in between the scans, I'm watching those Potter's videos, if
Hmm.
not PDF at least,
Yes.
because I'm used to the app now, like how
Yeah.
we were used to Marrow app back then.
Yes.
Now it's like CR. You go
Yeah.
to CR, in a PDF, just go through it.
Yeah. Yeah.
So it's
I
like
think that way a wide spectrum of things have been covered, and then it's an
that.
ever evolving app, and just like radiology, you can't finish it. It's not
Yes, yes.
need PG prep, so you keep learning. I'm pretty sure after you're done with the exam also you'll want to keep going back, whenever you see a case and you want to report it. So that's the
Yes.
aim. Great. If you want to tell your juniors, who might be starting out now, how
Mm.
should they go about using the app so that they are well prepared for, the exams in the 3 years?
So, like how I went about it was, ma'am,
Mm.
I have written all the systems that are like how we divide MSK, chest, everything. And based on the system with the search in CR, I used to search chest. So, whatever the chest classes used to come, some 10, 15, I used to watch them in a priority order, ma'am. Like first, I used to watch all yours, then Nikita ma'am's, and
Mm.
then recently Aisha ma'am's videos also I've been into. So, I divided into systems, ma'am. According to that, I went according to the videos. And in between, let us say I'm like bored or something, I used to watch spotters videos.
Right.
Spotters are not like only spotters in this app. They give you some information about the topic itself. So
Yeah.
that's how I used to jump here and there, but system wise I
Nice.
used to go. And finally we got only some 20 days ka
Mm.
exemption to read, that too with night duties and everything. We
Okay.
didn't have a entire period of off to read in library like that. We used
Okay.
to do duties and read.
Hmm.
So it went like I collected all 10 years ka papers, and when I went through them, it was like
Hmm.
common topics were
Yeah.
asked, and
Yeah.
all those common topics, for my luck, they were covered in the app by that time.
Hmm. Hmm.
So yeah, I went through all the videos, particularly the artifacts and all helped a lot, and yeah, like that.
Great, great. Very happy. So if you can tell, the juniors who might be looking to pick up Continental, DNB Radiology, what was your experience like? How hectic was the residency? How were the academics like there?
Not too hectic, ma'am, but
Hmm.
some months of the year when the patient case load is high, then might be hectic.
Okay.
Like for our batch, I think we started doing duties early, ma'am, but we got our juniors little late. I think this is the story of
Yeah,
every
every
resident, I
year.
guess.
Yeah.
So
Yeah.
that's how we were like stuck in first year only for 1 year, 4 months.
Oh.
So we were doing night duties, and after coming to third year also, we are somehow like you guys are third year, so you're more responsible to train your juniors. Bolke, we are getting more duties. So so again, the cycle is repeating. Only I think in second year we were little free
Hmm.
to buy this app, do some stuff.
Right, right.
Again, third year it was all about thesis and all for 2 months. So I
Hmm.
don't think third year is like this only in everywhere, I guess.
Yeah.
But first year also it was a little hectic for us. But it's okay, ma'am. Like moderate workload, you
Okay.
can learn things. Yeah.
What was your thesis on?
My thesis was on hepatic artery variant anatomy and liver transplant. This thing.
Great,
So
great. All right, amazing. So
yeah.
very happy to hear, and talk to you. Hoping to catch you after practicals also. I'm sure you're going to do amazingly well. All the very
Yeah.
best. And
Thank you so
see you on
much,
the other
ma'am.
side. Yeah, very
I
happy.
didn't expect this. I didn't expect this thing to happen because during NEET PG time, rank was not that good to get a chance to talk
Very
to
good.
you.
No,
But
no, it was very good. And I'm so happy that you've also seen my entire teaching journey.
yeah, from the day you joined an academy, from that time I was like, when you started the app, I was like, yeah, this is the go-to app. I have to take it. I don't know. I was just having bharosa on you that no, I
Yeah.
have to take it and do
Thank you
it.
so much. That means a lot, and I hope that I'm able to deliver. So thank you so much for that trust.
Thank you.
Thank you.
Thank you.
Thank you. Bye. Bye. All the best.
Bye, ma'am. Thank you.